At the beginning of the pandemic, we saw that our numbers in the emergency department dropped drastically. As an emergency physician, that was quite anxiety-provoking as we were wondering where our patients were located. Not long after, we started noticing that patients were quite anxious to come to the emergency department, and when they did come in, they were very, very ill. And that's what launched the initial thought of developing a virtual emergency department in order to reach the patients that were too anxious to come to the emergency department. As the numbers started coming back up and our patients started arriving in the emergency department, then we faced the challenge of social distancing. And so our wait times have gone up. And so this is really a program that we are able to see patients virtually that aren't having conditions that are life-threatening, which is allowing the patients that are quite ill to actually come in and receive the best care that they can get. So the Emergency Department Virtual Care Clinic is a clinic run by the emergency physicians that you would normally see in our department at Health Sciences North. It is a same-day program where patients log onto the website, request an appointment, and at that point they are seen by a nurse to triage like they would in our emergency department, and then they are seen by a physician. You get to see a physician quite quickly and there is less wait times, and we are able to arrange follow-ups such as x-rays, prescriptions, and consultations to specialists that same day. It's very accessible for the patients that live, an hour away, that have disabilities, that aren't able to actually physically arrive in our department. This is just a second option to allow our citizens to access quick and great care.